Hi guys, okay, now we'll study something about the structure, or where you call it as anatomy of the uterus. Now, location of the uterus, which is situated between the urinary bladder and the rectum, and you can see the uterus is going to be a pear shaped structure and it is going to be flexed on the urinary bladder. So the position we will call it as anti-flexion uterus. Okay, now you can see at the posterior portion we have got the rectum. That is why when the uterus is filled with the fetus, or when the fetus is going to grow inside the uterus, it gives pressure onto the urinary bladder and it gives pressure onto the rectum. So this will lead up into frequency of micturition and this will lead up into constipation in the mother. The size of the uterus, when you take, it is going to be of 7.5 centimeter long, it is going to be of 5 centimeter wide and 2.5 centimeter in thickness. Okay, and now when you see the size of the uterus is going to be bigger in the pregnant women, and after the menopause the size of the uterus is going to shrink because of reduced amount of sex hormones in the female. Okay, now anatomical divisions of the uterus. We have the first portion, which is a dome shaped structure, which you call it as the fundus of the uterus. Next, it is going to be the tapering body, or where you call it as body of the uterus. The inner portion of the body we call it as cavity. Okay, uterine cavity. Next, the inferior narrow portion we call it as cervix. Okay, now in between this body and the cervix there is going to be of about narrow shaped portion, where what you call it as isthmus. This is something of about 1 centimeter long. And when you talk about the internal portion of the cervix, it is called as the cervical canal. Okay, this cervical canal will have two os. One you call it as the external os, which is opening into the vagina, and the other we call it as an internal os, which is opening into the uterine cavity. This cervix is going to project inferiorly, posteriorly, and enters into the anterior wall of the vagina at nearly the right angle.